Colonoscopy later than 270 days in a fecal immunochemical test-based population screening program is associated with higher prevalence of colorectal cancer. Introduction. The immunochemical fecal test, FIT, appears to be a more acceptable and accurate alternative to guaiac-based fecal test. FIT implementation in organized screening programs has been associated with a substantial reduction in colorectal cancer, CRC, mortality. In addition, a very high cumulative detection of advanced adenomas has been shown after multiple rounds of FIT, indirectly supporting FIT efficacy in CRC incidence prevention. Thus, FIT-based screening programs are now being implemented in several European countries, with approximately 4 million tests estimated to be performed each year. As a first-level test, FIT can only filter out a fraction of the asymptomatic population at higher risk of advanced neoplasia. Its ultimate efficacy, however, depends on post-FIT positive colonoscopy, during which early CRC can be diagnosed and precancerous polyps removed. In recent years, the time interval between a positive FIT test and post-FIT colonoscopy has been shown to affect FIT efficacy. In detail, a 10-month or greater interval has been associated with a higher prevalence of CRC, especially its advanced stages, and advanced adenomas at post-FIT colonoscopy. This was postulated to be due to the progression of FIT-positive advanced neoplasia during an excessively delayed post-FIT colonoscopy, and such hypothesis has been confirmed in a recent simulation model. Recently, such association has been confirmed in the FIT-based Taiwanese screening program, as well as following a positive guaiac-based fecal test in Israel. These data have yet to be confirmed in a European setting where organizational issues may show different outcomes. According to European CRC screening guidelines, the interval to post-FIT colonoscopy should be within 31 days. This criterion is actively surveyed in Italy, where a 90% or greater interval to post-FIT colonoscopies in 30 days or less is recommended as a desirable programmatic outcome. However, due to organizational issues and limited endoscopy capacity, more than half of colonoscopies in Italian organized programs are performed beyond the 30-day cutoff. The aim of the current study was to assess in an actively monitored FIT-based program in Italy whether a delay to post-FIT colonoscopy was associated with a higher risk of CRC. Background. Colorectal cancer, CRC, screening programs based on fecal immunochemical testing, FIT, generate substantial pressure on colonoscopy capacity in Europe. Thus, a relevant proportion of FIT-positive patients undergo colonoscopy after the recommended 30-day interval, which may be associated with an excess CRC risk. Methods. In a cohort of 50 to 69-year-old patients undergoing biennial rounds of FIT, OC Hemodia latex agglutination test cut off 20 micrograms of hemoglobin per gram of feces between 2004 and 2017. The authors assessed the outcome at colonoscopy, low or high-risk adenoma, CRC or advanced stage CRC, among FIT-positive patients according to different time intervals. The association of each outcome with waiting time and demographic and clinical factors was analyzed through multivariable analysis. Results. 120,138 of 154,213 FIT-positive patients, 79.8%, underwent post-FIT colonoscopy. Time to colonoscopy was 30 days or less, 31 to 180 days, and 181 days or more in 50,406, 40.9%, 71,724, 58.3%, and 1,008, 0.8% patients, respectively. At colonoscopy, CRC, high-risk adenoma, and low-risk adenoma were diagnosed in 4,813, 3.9%, 30,500, 24.8%, and 22,986, 18.7% patients, respectively. An increased CRC prevalence at colonoscopy was observed for a time to colonoscopy of 270 days or more, odds ratio, OR, 1.75, 95% confidence interval, CI, 1.15 to 2.67, whereas it was stable for waiting times of less than 180 days. The proportion of advanced CRC also increased after 270 days, OR 2.79, 95% CI 1.03 to 7.57. No increase for low or high-risk adenomas according to time to colonoscopy was observed. Conclusion: in a European FIT-based screening program, post-FIT colonoscopy after 9 months was associated with an increased risk of CRC and CRC progression.